Assalamu alaikum wa rahmatullah. Hello everyone. My name is Mustafa Zain and this is COMSTECH Podcast. Today we have a special guest. Our guest is a global authority bridging the gap between traditional wisdom and modern biotech. Professor Liu Xinmin, a chief scientist at Ningbo University and a WHO expert advisory panel member. In this episode, we tackle three groundbreaking themes. We explore why brain health becomes the professor's lifelong mission and define what truly constitutes a smart herb. We discuss how microgravity affects the brain and leads to memory loss, and the incredible progress of sending herbal active compounds to the Chinese space station to protect the health of future astronauts, including those planning to travel to Mars. We highlight the 20 years brotherly scientific partnership between Professor Liu Xinmin and Professor Dr. Muhammad Iqbal Chowdhury. We will discuss how combining Chinese advanced technology with Pakistan's rich medicinal plant resource is creating a global impact. Professor Liu Xinmin, it is a privilege to have you with us.
Thank you.
First of all, thank you very much, Professor, again. Could you please give us an overview about your research, your projects?
So my research work is focused on the neuropharmacology. It's me especially because the drug discovery or food function from the medicinal plants. This is my major activities. Also in the past 20 years, so I work on the space medicine. It's used, of course, also is related to herbal plants. Cooperated with my brother, Chowdhury Iqbal, more than 20 years in the area of herbal medicine, space medicine, animal model.
Professor, with a career spanning 40 years, why has brain health been your lifelong priority?
Yeah, this is long stories after I graduated from my university. It's this is about almost 40 years ago. So in that time, I noticed that many people suffering with the sleeping problem and memory, and also the depression. So at that time, I'm interested to how to improve these problems. We call it the neurodegeneration, or just like I mentioned, brain health. As start from that time, I take my research, my priority research areas up to now.
Interesting. Professor, given your expertise in neuropharmacology, how exactly do natural products improve memory?
As you know, the memory, you take this not like memory is, I can say, is challenge diseases in the nationals because we don't know which target or which biomarker they have for the memory problems. So that's why the many, I think, conventional drug is not easy to treat or to prevent memory loss. But as I understand from my knowledge, the traditional medicine, in such as like herbal products, there are multi-target. Also, they are very, because they come from the nature, it's safe. So, based on my 30 or more than 30 years experience on herbal research, it's very useful with the herbal medicine to treat neurodegeneration diseases.
Professor, in your research, you often mention smart herbs. What scientific criteria define a smart herbal drug?
Smart means clever, but I think it's effective with the safety. We can call this a smart herbal medicine. Of course, we name is easy, but how to find, how to get the rare smart herbal medicine is not easy. We need a lot of research, including the animal research and the clinical trial.
Could you please give us some examples?
Okay, there is the Chinese ginseng. It's very popular. Let's say I consider it's a very smart herbal medicine. The herb ginseng is we find it's ginseng first. We find get the traditional Chinese and many we got the ancient document and also research papers. First, we collect the information to get which effects of ginseng they have from the books or documents or papers. After that, so we use the raw materials of ginseng. So extracts and the isolation as the test samples from the ginseng. Then with the animal model, like memory loss or depression model, make the confirmation. This is the first step. Animal model after make the effective, of course, safety is also important. Then come to the clinical trial. It means used in home beings. So make the confirmation in clinic. So then they come to the product as the highest function food or new drug. This is very smart herbal medicine.
To bridge the gap with modern medicine, how do you validate traditional remedies?
Yeah, I think that's also again like the same. We validate. We need the science evidence. As you know, herbal medicine, most of it come from the traditional use. Is we get the evidence from the traditional. It's case by case. It's important to use the science evidence for the modern society. Let the people accept the science evidence. First, one is in pre-clinical trial, means the animal test. Find the in vivo, get the confirmation with efficacy there, and what's the mechanism? We use like biology, like artificial intelligence, and many we call them modern technology to make the confirmation in the animals, also in the home beings. That's we call it validated the science evidence.
Professor, considering the aging population in China and globally, can we truly prevent brain aging naturally?
Yeah, prevent this is possible. As aging, as you say, if everybody know now with the development of economic, So now the people, the aging, in China, for example, is now about 20% of population, the age is older than the 65 years, is age. So everybody want become the young, want to prevent their age. So nature products or herbal medicine, I think is very helpful for prevent.
Professor, now we want to move from Earth to the cosmos. Why is it strategically important to study herbs in space?
This is a new area in science. In science, I reached this area is almost 30 years ago, which because my institute, 30 years I work in, we call it Institute of Medicinal Plant Development in Chinese Academy of Medical Science, which is near the, we call it the Chinese Alternative Center. At that time, I was taught there are very different streams, like microgravity, like the radiation in space will be induced. The neurodegeneration is like the brain function dysfunction. So I think maybe we can use the herbal medicine to test. So at that time, so we start the space medicine. We call it space herbal medicine. I think this is also the advantage of the herbal medicine could be used for the astronaut.
That's very interesting. Can you give us overview when it starts and which level now?
Of course, now because it's basic research, I can say, like we set up the different animal model, which on Earth, including microgravity model and also radiation animal model, is could induce the memory loss. This is one model. Then we screening about so far. We screening about 30 Chinese herbals. We find this thing about I cannot clear to exact numbers. I think maybe around 5 or 6 Chinese herb plants is very useful for neuro diseases which induced by the space environment on Earth. And this is first also last year we sent the one Chinese herbal activity components into Chinese space station. This is the first time we test herbal medicine in space. This is what our progress so far regarding the space medicine, space herbal medicine.
Professor, how specifically does microgravity affect the human brain? How?
Yeah, microgravity this means the less gravity in space compared with Earth. So this is different environment where we make the totally, this is our body in the different stress, microgravity. Based on our 30 years research, microgravity is major factor to induce memory loss. That's all. Either from the animal models, also from the published papers about the astronaut, USA and Russia. They all made papers report microgravity definitely induced memory problem.
Could you explain your tail suspension invention for animal models?
Tail suspension is, I think this is one animal model which like the microgravity in space. This tail suspension animal model is recognized internationally as the space environment stress could be induced. Memory loss, also some cardiovascular diseases. Tail suspension animal model.
Professor, looking at future mission, can these herbal interventions protect future Mars travelers?
Possible, but there is a long way to go. It's very, we face the challenge. Mars, you see now, even now, many problems in the space. We are still on the way to research, but the possibility is there. We guess with the advanced or with the development of the science, I think problem with the Mars, I think we can find some solution to solve the highest problem when home being in Mars.
Professor, after sending samples to the Chinese space station, what has been most surprising finding so far?
I find this for two activity components from the Chinese ginseng. We call the RG1 or RB1. This is called activity components, which isolated from American ginseng. Also, we use the different animal model, like the one we call the microgravity animal model. Also, it's a sleeping interruption model. We find this very effective to the memory loss, also for depression and anxiety. This is well found.
Professor, you recently participated in the PAC China conference on food and medicine. How would you comment on its outcomes in promoting the concept of food medicine homology?
Food, I think now food and the medicine, maybe for many people think this is different. In fact, the medicinal plants could be used as food, also as the medicine. Now the boundary of food and the medicine now is more and more close. This conference, we organized the China, Pakistan Food and Medicine Harmonology on home health and nutrition. I think it's very successful. Also, it's important to share our knowledge and the information about how to use herbal medicine in food or in medicine. In China, many herbal medicine already they are used as a food, regular food for home beings. Also, the same plants going to be used as the medicine in clinic. Of course, we need to set up the standards for ensuring use, safety, efficacy for herbal medicine which used in food or in medicine.
Professor, what was your role with WHO?
I'm the member of the expert panel advisory on traditional medicine in WHO since 2008. So it's recommended by the Chinese government. In the past, almost, I think, 20 years, more than 17 years. My responsibility is provide technical support on how to make the strategy for national status. Also, I helped the WHO to make a global survey. What's the situations on herbal medicine and how to make the benefit which herbal medicine they use combine with the Western medicine. The one WHO monograph has been published in 2021, which titled the Herbal Drug Interaction, which I have been invited by WHO to coordinate. There are more than 20 country members send the expert to organize the work group to design, to edit. So I'm coordinator. This is WHO document. It's helpful the member states to how to use the herbal medicine which if taken together with Western medicine. Also, I help to organize one we call the IRCH, which is the International Regulatory International Regulatory Cooperation, harmonization for herbal medicine. The secretary is in WHO headquarters. Anyway, so as the consultant on traditional medicine for WHO, so we provide our suggestion and comments, what's there required by the WHO, also by some member states.
Professor, based on your 20-year bond with Professor Dr. Muhammad Iqbal Chowdhury, why is China-Pakistan scientific cooperation vital?
Yeah, that's the. As first I said, just I should very appreciate Chowdhury Iqbal. It's more than 20 years ago, I know him in Karachi University. So in the past more than 20 years, Chowdhury Iqbal support me and my team without condition as a conditional and substantial support. Any requirement we want, we can get the response from the Chowdhury Iqbal. See, if you talk, why should the cooperation between China and Pakistan? I think first, we are long-time friendship, relationship. We are brother countries. So once we required either from the Pakistan side or from the Chinese side, both countries, not only between me and the Iqbal, I think all the Chinese scientists and the Pakistan scientists, their response, they make any requirements if they want. I think both of we are do their best to satisfy. One is relationship. We are brothers. The second one, I think, is we have the different advantage. For example, we're going to take the herbal medicine. In China, I can say there are comprehensive system how to regulate, how to make the quality control of herbal medicine. We have the start from the medicinal plants to hospital and the manufacturing, or we have advanced technology. We have the experience for Pakistan side. Understand also there are plenty of resources of medicinal plants. Again, there are also the traditional medicine, the long history of the tradition, longer history of for use traditional medicine. Both of countries we believe useful of the traditional medicine. So that also we can combine the Chinese technology with Pakistan's resources and the market. So we can promote or we can establish maybe herbal industry for beneficial both of the Pakistan and the Chinese peoples. The second one, as understand, Pakistan is leading country in science technology in Muslim countries. So if we cooperate with Pakistan scientists like the Professor Liu Xinmin, our products or our achievement we can share not only with Pakistan, also we can go to the Muslim countries. This is many reasons I can say we should cooperate.
Interesting. Professor, to ensure safety everywhere, how do we work towards standardizing herbal medicine on a global scale?
This is a tough challenge question. When I was in WHO, also this is major target or major task for WHO. Now, for standardization, I think because herbal medicine is not like the Western medicine, just one single components is target on single target. Herbal medicine, they have many components inside. Of course, the target, we call the multi-target. It means we cannot use the one single components to make the quality control for herbal medicine. So follow my knowledge, we should make the quality control start from the cultivation, start from the farm. Then the isolation, make the precision, then the manufacturing, then up to the clinical trial. We should set the different standards in the different stages for herbal products, which we need the quality control for whole chain of the herbal medicine, either from the cultivator to research, to clinical trial, to marketing, to the patients or customers.
As a recipient of high honors, what does receiving the Sitara Imtiaz from Pakistan mean to you?
I appreciate the Professor Liu Xinmin. Under his support, I was rewarded the President Award last year. This means our cooperation on the herbal medicine between two countries is recognized by the Pakistan government. It's not only my own, also is recognize our cooperation in research of herbal medicine between my team and the EcoBar's team. So I remember one sentence used by your, I think by your government is encourage, is recognize the Professor Liu's contribution to promote TSM in Pakistan. So I'm happy. Also, I will. It also means encourage my team and to do more for promote our cooperation in the herbal medicine.
Finally, Professor, for the next generation of scientists, what is your core advice for research entering the field of natural products?
First, I think for younger researchers, I encourage or I hope younger either from Pakistan or from the China, I hope they can make more close to cooperation either in herbal medicine or in space medicine. For younger scientists, they can training. We can Pakistan scientists, they can come to China to get the training on science, knowledge, herbal medicine. Of course, for Chinese scientists, they can come to Pakistan to understanding, to get the knowledge how the herbal plants or traditional Iranian medicine is working in Pakistan. And let the younger generation, or like younger scientists, like our, I cannot say I'm old, but compared with the younger scientists, I hope our youngest generation can continue our cooperation, like my team, like me and the Professor Ikobar, bridge our two countries. We continue our friendship, our research, our cooperation, combine our advantage to do more either research programs or activities to beneficial for ourselves, also for our countries, either Pakistan or China. See, now I think it's good opportunity for researchers between China and Pakistan to cooperation. So now, also Chinese government encourage Chinese scientists to cooperate with Pakistan scientists, especially for younger scientists, understanding the different funding the Chinese government support, especially for the Pakistan scientists. So for Pakistan research, they can take this very good opportunity to get benefit from the Chinese side.
Okay. Finally, how do you see the future of space herbal medicine and the future of relationship between Pakistan and China in terms of science cooperation?
Space medicine, that's a new area. So this year we started the first, I can say we were started the first time we called the China-Pakistan cooperation on space herbal medicine. That's right. Also, as everybody knows now, Chinese space station we have first foreign country, Australia. I'm proud Pakistan is the first country who sent the Australia to Chinese space station. I think many activity or many the things we can do, of course, and huge challenge we are faced in space medicine. So I'm sure under our cooperation, or especially under the leadership of the Chaudhry Iqbal, we can design the different programs. We can combine our advantage resources and the support from the Pakistan government and the Chinese government. Of course, also under the umbrella of COMSTECH. I think either research or industrial or commercialize for herbal medicine, space medicine, we can continue to do together.
That's great. Thank you very much, Professor.
Yes.
We are very glad to have you.
It's my pleasure. This is our brother countries. Thank you, especially for what I would appreciate. My brother, Chaudhry Iqbal. Our outstanding achievement so far, I get, my team get, is due to the Chaudhry Iqbal's support. Thank you.
Thank you very much.